Hi, welcome to SaveOurBoobies.com. My name is Gina Andrews, and I have a very special guest today, Dr. Christian Swanson. He's from Mercy here in Sacramento, and he's a general surgeon, but his specialty is in breast cancer. Thank you so much for being here today, Dr. Swanson.
Oh, you're welcome. It's my pleasure.
Can you tell us a little bit about your background?
You know, I was born in Oakland, California, grew up in San Jose, went to medical school in St. Louis, and then came out here and trained at UC Davis. I've been at Mercy General Hospital and here at Mercy Medical Group for the last 15 years.
Oh, wonderful. And can you share with us a little bit about why you're so passionate about breast cancer?
You know, it is something that I see every day, every single day. I think Sacramento is a very wonderful, lucky community to have great physicians. They're just wonderful physicians here in town. But I see breast cancer every day. And it's really, it seems like it's younger and younger women that I tend to see over the years. And it's something that if you are quick to pick up on and treat, you're more apt to do better than if you don't. Right. So it is something that I see all the time, and it really is important to me.
Do you know what the youngest women that you've was diagnosed with breast cancer?
You know, for me, it's been in the mid-20s. Although really it is more in the 50s, 60s, and 70-year-olds. Right. But we do see it in the younger women, there's no doubt. So importantly, do not ignore a mass or a lump or anything that's abnormal. Bring it to your physician's attention.
And you mentioned to me that some of your patients have been diagnosed with breast cancer during pregnancy and even after pregnancy. Can you talk a little bit about that?
You know, and a lot of people would think, gosh, it's not going to happen while I'm pregnant, but it can. It absolutely can. And so again, if something's unusual or just something doesn't seem right, let your doctor know. So don't completely ignore a mass or anything abnormal.
And here on our website, we really promote awareness in young women. Can you also share with us a little bit the difference in the type of surgeries that you perform, and how do you go about determining what type of surgery would be fit for that patient of yours?
Yeah, that's a really good question and a very difficult one to answer in a short period of time. But in general, when a person is diagnosed with a breast cancer, you have two different surgical ways to go about that. And one would be breast conservation, where you try to save the majority of breast, taking out the tumor itself with the rim of normal breast tissue. And that usually is followed by radiation therapy, versus mastectomy, where the whole breast is removed. Now, it's a lot different than it used to be, where the muscle was taken. Now the muscle is left intact, and just the breast tissue, and usually including the nipple and the areolar complex, is taken with the breast. In both of those scenarios, you still want to look at the lymph nodes if it's invasive disease, if it's in situ disease or cancer that does not spread outside the breast, then usually you don't have to look at the lymph nodes. But we know from studies that you can choose lumpectomy or mastectomy and have, in almost all cases, equivalent survival. And it comes down to a personal choice. There are times where if you have a smaller breast and a larger tumor, it's not feasible to remove just the lump and leave any significant breast tissue. But there are times where you can do chemotherapy ahead of time to shrink that tumor and then make it so you can do breast conservation or save the breast.
Are you seeing younger women opting to have a mastectomy versus a lumpectomy because of, one, they're so young, two, the aggressiveness in young women is obviously higher, and then three, you know, obviously these women, young women, either have young children or wanting to have children in the future? Yeah,
you know, I've seen the pendulum swing back and forth. When I first started my practice, it was mastectomy was the more common option. And then over the years it started to swing. The national trend became breast conservation or lumpectomy. And then I've seen in the last couple of years that pendulum is swinging back to where more and more of my patients are opting for a mastectomy with or without reconstruction. So I would say that in the last couple of years, yes, I've been seeing more and more mastectomy. I've even seen where more of the patients are coming in saying, gosh, I want to consider both my breasts being removed. And we would traditionally do that where we'd have a more high-risk individual who had a very strong family history. But I've seen it more and more where at least the question comes up from them, should I consider removing both breasts?
For someone that maybe just been diagnosed, could you think of a couple of important questions that a woman should ask their breast surgeon?
That's a really hard situation. You know, your whole world gets turned upside down with a biopsy. Probably the most important things are to make sure you're with someone who does a lot of breast surgery. You have multiple options. If someone says you don't have any options, I would take a step back and research things further, because almost always you have options.
Right.
After you've done that, then make sure that you yourself are comfortable. And sometimes that just takes time. If you're looking at breast conservation or mastectomy, sometimes it will take an extra couple weeks, and you may think, gosh, I need to get moving, I need to get this done. But sometimes that period of time really allows you as an individual to make that personal choice and find out what's best for you to get you back to normal life.
Any advice you would give to someone that's probably in their early 20s that haven't had breast cancer but might have it in their family? Should they do their monthly self-breast exams? And like you said, if they find something, to go see their doctor immediately?
Yeah, I would encourage women really starting in their 20s to just, if not for the sake that it's very unlikely they're going to find an abnormal mass that would be cancer, but it's a good practice to get into. And so I would very much encourage it. And don't be afraid if you find something that's abnormal. Before we would say, gosh, give it a month or two and let's see if it goes away, and then bring it to your doctor's attention. I personally would say, let them know about it, and they can reassure you and say, no, it's fine. So if you do find something, bring it to their attention, and get in the practice of every month checking your breasts to make sure that you not only get better at it and more comfortable, but you're more apt to know what's normal for you.
Right.
What's a lump that, gosh, I've had that for a long time,
Right.
and it's not changing.
I know a lot of women that I've come across had made a comment that their significant other or spouse have found a lump in their breast.
Absolutely. I do hear that also. And I think it's very important, if your significant other does bring up something that is abnormal to them, although you may think it's normal, don't discount that. I think it's really important to take that information and bring it forward.
Okay, great. Well, thank you so much. That's great information, and thank you for being here and sharing that information with all of us. And we are going to have Dr. Swanson's information on the screen. If you have any information or live in Sacramento that would like to see Dr. Swanson, his phone number and contact information will be on the screen. So thank you so much for joining us. I'm Gina Andrews.